In this video, I want to talk about the treatment of bipolar disease. So bipolar disease is a mood disorder. So we have already talked about major depression, and now we're going to talk about bipolar, which involves episodes of elevated mood as well as depressed mood. So although we're not going to talk here about how to diagnose bipolar, we're going to focus on the treatment. I just want to give you a brief introduction that you can think about what bipolar means. So if you're thinking about mood in general, elevated mood versus depressed mood, so let's think first about how does an average person look like? Well, it goes all over. So you meet someone, he doesn't like you. You get an A in college, you get a C, you have a nice family event, but you don't like all the people, and it goes on and on. So like something like this, that's an average person's mood. So let's call this line average Mary. Okay, so now how does someone look with major depression? So let's do this in green, major depression. So there are prolonged episodes of depressed mood. So we're going to see something like this. That's something like major depression would look like. Now we're going to get to bipolar, and there's actually two different kinds that you should recognize or should have heard about. That's bipolar 1, and then there's also bipolar 2. Let's see how they look like. So in bipolar 1, you have episodes of elevated mood, and this is called manic phases or mania. So things like here you go up, and then you can also go down significantly. Although I have to say, for a diagnosis of bipolar, this down periods, the depression is not necessary. So the moment you have one manic episode, you have bipolar. So you don't necessarily need the depression, but a lot of times it happens. And this needs to be at least a week. Okay, now bipolar 2, there is just less severe in terms of intensity and duration symptoms of mania. So we should also label that. So that's manic phase, mania. And in bipolar 2, we call it hypomania because it's just not as severe. But here you're going to have some periods of low mood. So that's going to be bipolar 2, and that's called hypomania. And for the diagnosis of bipolar 2, you need hypomania as well as depression. So that's just as a brief introduction what we are talking about. We are now going to talk about treatment options with drugs for bipolar disease. So let's start with the different treatment options. So I want to first give you a big picture overview. There are 3 drug classes or 3 drugs generally to consider. Number 1 is lithium, and that's our first line drug generally. This is a very old drug but works pretty well. And alternatives are some anti-epileptics. So medications that you use to treat seizures, but there's only 3 that you can use. It's carbamazepine, lamotrigine, and valproic acid. These are the 3 anti-epileptics that are used for the treatment of bipolar disease. These are called also mood stabilizers. And then there are antipsychotics that you can use, and preferentially the 2nd generation. Now a couple of words about generally these medications. So lithium is the first line because this is the one that has shown in studies a reduction of mortality in patients with bipolar disease. So the problem with bipolar is suicide, because these patients with bipolar also have the energy to commit suicide. So in studies, lithium was the only drug that really showed significantly reduction of mortality in patients with bipolar disease. So that's lithium. If that's not an option, we're going to see it's a pretty toxic drug, lots of adverse effects. Anti-epileptics are available, these three, and antipsychotics, particularly second generation, things like olanzapine or quetiapine. I also want to mention that if you have a patient with an acute manic phase in the ER, very agitated, antipsychotics are going to be the first line for an acute treatment of manic episode, because it's going to take too long with lithium. So that's where they come on as a first choice. But otherwise, for chronic, for long-term, lithium first choice, and then you can either use any of the others in case lithium is not going to be an option.